We've talked a lot about getting to work with the people as our patients, but I think we're also so lucky to be in such a collaborative field, especially in this internal medicine year that we get to have at St. Luke's. We work as part of a team, so there's always at least a few interns, a senior resident, an attending, and also usually several different medical students that we get to work with. And being able to really talk about each patient during rounds, one-on-one, and really everyone gets to brainstorm a little bit and throw in their ideas, I think is like so fun, and one of the best parts about being in this year that we get to be a part of, and one of the best parts about medicine. And I think it's just fun to get to work with each other, but I think we all also happen to get along really well outside of the hospital too, and we play trivia and go to bingo and just explore the city, which has been super fun too.
One of my favorite things that we do, and I don't think this was meant to have happened, but we just have this thing where at the end of every rotation, somebody just naturally just organizes some kind of group hangout. And it's almost become this really fun tradition where I look forward to the Sunday at the end of every rotation, because I know someone's gonna host, or we'll have some other event, or we'll go do trivia or bingo or whatever else. And it's just been really great to have this time with these just amazing people. So I feel very lucky.
We haven't figured out what we're doing this Sunday yet, though.
Yeah.
I just love hearing your guys' passions for your specialties too, right? That's so fun and insightful for me. I see a patient with a rash and I'm like, oh no, oh God. But I know if I show Brandon this, he's gonna be really excited, or this, or even a cool a cool X-ray, being oh yeah, Max or Mead or someone's gonna want to see this and learn from it. And I love that. I love having all these different specialties at our fingertips is what it feels like.
That's actually another reason I went into radiology, is because of being able to interact with colleagues. And I feel like this year so far at St. Luke's, being able to interact with senior residents, co-interns, medical students has been one of the best things about the year.
And I think I'll add too, I think the program does a really good job of creating opportunities for us to get together and be closer teammates too. A couple months ago, we did a resident retreat in Lake Geneva, which was a ton of fun. We were there overnight. We did a little boat ride and had dinner together, played games. And I think for me personally, it was just a really great opportunity to step away from work and go and get to know the people that we work with every day. So I think that's a unique thing about this program that I've really enjoyed, and I think it's not just that one retreat and we're done either. We're going next week to our program director's house for a holiday party, which should be really fun. So I really think this program's been good for me. It's lifted me up and made coming to work every day a lot easier because the people that we work with are so great.
One of my favorite things about my day every day is showing up to noon conference and getting to see everyone that's on different rotations that I don't usually get to see.
Yeah, I mean, I think my first month on wards, I was actually co-interns with Allie, and I think we were both terrified. At least speaking for me, I was terrified. I had done 2 medicine wards back in med school, and they were both good experiences, but they were just very busy, very time-consuming, and at times in med school, I worked with teams that weren't always the most functional or fun. And so I think going into wards as a resident, a new intern, I was nervous, but I think that's normal to go in and be nervous. And thankfully, working with Allie, and we had a great senior resident, great medical students. I think after the first couple of days when the jitters kind of settled, we put in our first big boy, big girl orders. I think we started to feel more comfortable. And I think, in times when it was just Allie or myself there, without a senior resident when he had the day off, there were moments where we'd kind of panic if we didn't really know what to do, but we always had each other. There was always a chief resident that we could contact. There was always a senior on a different team we could contact. Our attending was always available. So I think for me, I was really nervous about feeling unsupported and alone and not knowing what to do, but we had a really fun group, we had a really supportive group, and honestly, it's been probably one of my favorite blocks that we've had, even though it was so busy. So
I agree. We had a great time in that team room.
I totally agree with you, Brandon. I would say it's really relaxed. I actually started intern year on nights, and so that was a little nerve-wracking, kind of covering 40 to 50 patients with the senior. And usually the senior would get sleep, but they would always tell me beforehand that I should feel free to wake them up. They were always not only helpful, but eager to help, which was really nice, especially for my first week of internship.
Thanks for doing that for all of us.
Somebody had to do it.
It may or may not have been my choice.
Speaking to work environment too, and on nights, I was just on nights, and my senior, who is currently Nina and I's senior, he is so worried about basically making sure that he's able to support whatever the intern is on nights, that he always sleeps with the door open and the lights on, so that he's always available for if we have any questions. And again, I think that again just speaks to like the types of people that come to this program. He does not need to do that. He's been up all day, but he does.
I think one thing I'll mention too is all of the other like non-doctor staff has been incredible too. The nursing teams are great. All the techs, the CNAs, everyone is super, super nice, really helpful. The pharmacy teams are really great. And so, you know, when you're at night alone talking to a nurse or pharmacist, or you're calling a consult at 3 in the morning, I think everyone's been really, really good to me so far. Like I had to call a general surgeon at 3 a.m. my first week of nights, and I was terrified to do it, but she was so nice, so willing to help out. So I think that just speaks to the whole hospital system itself. I think has really good working conditions. Everyone is there to help you and support you, and most importantly, to help the patient.
I'm so glad you mentioned that, because I feel like all of the support stuff that we have really speaks to how much the people here care about our patients, because I feel so comfortable talking to the pharmacist and asking for their advice on, you know, a certain medication if my patient has kidney disease, for example, but also knowing that I can talk to our social workers and our case managers to help make sure that our patient has really good and adequate follow-up once they leave the hospital too, because that is so important. And I've really been blown away with how supportive and encouraged and eager everyone is to help us too.
I think there's so many different areas of expertise within medicine, and as doctors we are maybe experts in one small area, but social work, pharmacy, like those are things I don't know very much about. And I think that the people who work for St. Luke's like seem to really take pride in their work, and I think that that shows in every interaction that you have with them.